Hello everyone and welcome to my second video lecture. My name is Mohammed Yahya Mansour. I am an assistant lecturer at the University of Baghdad College of Dentistry Department of Oral and Maxillofacial Surgery. I am uploading short video lectures in clinical oral surgery which can be useful for both dental students as well as graduated dentists. So if you are interested in this subject, please subscribe to the channel and turn the notification icon on so that you know when I upload a new video. In this video, I will remind you with the main areas that need to be examined in a dental patient extraorally before starting the oral surgical procedure. So let's get started. There are two important key points that will help you in achieving a thorough clinical examination. The first point is to be systematic. That is to do the examination steps in an orderly fashion so that you don't miss anything. So in this video, the areas to be examined will be roughly organized from the top to the bottom of the face. The second key point is to keep in mind that the clinical examination of each part or area should include visual inspection, palpation, and auscultation as applicable. Now, after taking the relevant dental and medical history, you may consider other areas to examine extraorally in addition to what will be explained in this video. So keep in mind that the purpose here is to provide a simple guide for extraoral examination, which should be applied as a minimum to any dental patient requiring dental extraction or minor oral surgical procedure under local anesthetic. So the extraoral clinical examination actually begins even before the patient reaches the dental chair. As you may notice how the patient walks or how they move in general and be able to detect and grade any mobility issues, the patient's physical activity or their level of tiredness or fatigue, in addition to the level of their pain if present, and its approximate location as the patient tends to put their hand over the source of pain. Now, after the patient is seated in the dental chair and after taking the relevant history, one easy yet systematic way is to look at the general appearance of the head and face, then start a more detailed examination from the top to the bottom of the face, then including the upper neck. So the face or head in general should be inspected for any asymmetry between the right and left sides. Then a skin inspection of the entire face should be done to check for any changes in the color, such as for patients with severe jaundice, the presence of rashes, or other skin lesions. Now, moving to the detailed examination of specific areas of the face, the first important area that needs to be carefully inspected is the eyes. So, starting with a general inspection, exophthalmos, eyelid drooping, and similar changes should be first noted. Next, the color of the sclera, as well as the color of the palpebral conjunctiva, can provide valuable relevant information to the oral surgeon. For example, bloodshot eye, jaundice, osteogenesis imperfecta, or anemia. The second area down is the nose and the maxillary sinus area. Now, as notes regarding inspection of this area should have already been taken during the general inspection of the face, the detailed examination now includes mainly palpation of the maxillary sinus area for tenderness, only if sinusitis was considered to be a possible cause of the patient's chief complaint, such as those who feel pain and or congestion in this area. The third area is the temporomandibular joint. Again, inspection should have already been done and only a few seconds of re-inspection should be enough to confirm the previous observations. At this point, palpation of the condylar head of the mandible during opening and closing to detect any deviation from the normal function should be noted. Inspection of the mid-chin movement and direct auscultation for any joint sounds can be done simultaneously in addition to noticing the range of mouth opening and any accompanying pain during the examination. Indirect or assisted auscultation of the temporomandibular joint is indicated if the patient and or the dentist were aware of joint sounds such as clicking or crepitus on direct auscultation. The fourth relevant area is the muscles of mastication, and the two muscle pairs that can be examined extraorally are the masseter and the temporalis muscles. The other two pairs are to be covered during the intraoral examination. Now, any asymmetry should have been already noted during the general facial inspection, which could be related to masseter muscle hypertrophy as one of its potential causes. So at this point, palpation of these two muscle pairs need to be performed while the patient is clenching their teeth to look for any tender spots while they are in contraction. The fifth area down is the lips. They need to be inspected for any changes in their color as a whole, such as pale lips or blue cyanotic lips, and their general appearance and size, for example, cracked lips or swollen lips, and for changes in specific areas, such as white, red, or pigmented lesions or ulcers. Now, the sixth observation need to be about the mouth opening in a more objective way than just inspecting during the previous temporomandibular joint examination. So measurements such as maximum comfortable mouth opening and maximum mouth opening are relevant to the oral surgeon. The seventh and last area is the lymph nodes. Preauricular, submandibular, submental, and anterior cervical groups should always be palpated to check for tenderness and changes in size. Keep in mind that if a palpable swollen lymph node was detected, its fixation to the surrounding structures should also be noted as a part of the palpation test. Now, if an abnormality in these four groups was discovered, then the other groups, such as the postauricular, occipital, posterior cervical, and supraclavicular lymph nodes, should also be examined in the same way. As mentioned earlier, this is only a brief standard extraoral examination before dental surgery. If some aspects of the history or the clinical examination revealed other potential problems, then the extraoral examination could be extended to include cranial nerve examination, thyroid examination, or even moving back for a more detailed examination of other parts of the body, such as the hands and fingernails, to aid in making the correct diagnosis. Thanks for watching. I hope you enjoyed this video, and I will see you in the next video.